It's time now for Morning Rounds, and this week we're taking a closer look at a disease that almost everyone fears, Alzheimer's. Joining us are CBS News Chief Medical Correspondent Dr. John Lapook and Dr. Rudolph Tanzi, Professor of Neurology at Harvard Medical School and Director of the Genetics and Aging Research Unit at Massachusetts General Hospital.
Last month in London, health officials from the G8 countries held a summit on the growing threat of Alzheimer's and other forms of dementia. British Prime Minister David Cameron promised to double his nation's commitment to research funding over the next decade to fight the global epidemic.
A new case every 4 seconds, a global cost of $600 billion a year, and that is to say nothing of the human cost. Because it doesn't matter whether you're in London or Los Angeles, in rural India or in urban Japan, this disease steals lives, it wrecks families, it breaks hearts. And that is why all of us here are so utterly determined to beat it.
I mean, John, we're seeing similar amounts of growth here in the U.S. Why now? What is different about this epidemic that's leading it to explode?
This is a huge problem, Vanita. Right now, there are an estimated about 5 million Americans who have Alzheimer's disease. That's expected to triple by 2050. Right now, we're spending about $200 billion in direct healthcare costs for people who have Alzheimer's. That's expected to maybe go to $1 trillion by 2050. So this is a huge problem that threatens to bankrupt us.
Dr. Tanzi, you spent your whole career fighting this disease. You discovered the first Alzheimer's genes. So where does treatment stand at this point?
Well, unfortunately, the available drugs are in that category of better than nothing. Yeah. They treat some of the symptoms and mainly temporarily, so the benefits go away after time. What we really need is a drug that will stop the actual progress of the disease. And as many people know, the recent trials on those types of drugs have failed. And so we're really back to square one.
You know, Dr. Tanzi, you've started a company to develop new drugs. It really begs the question, can new detection techniques actually help advance the treatments that we're seeing?
Yes, well, see, I guess there's good news and bad news. The good news is that thanks to the many genes we're discovering, I run the Alzheimer's Genome Project from Cure Alzheimer's Fund, which has been very, very useful for showing us dozens of genes involved. We now have a good picture of the stages of the disease, going from this gooey, toxic material that sticks to the nerve cells and kills them, and then the nerve cells die from within. And then, even worse, the brain sees all this and thinks it's an attack from the outside, and the immune cells start to attack the nerve cells, and nerve cells die by friendly fire. It's like an inflammation reaction. So you get these 3 stages. Now, the bad news is that even with this information, when you look at what we've been doing in clinical trials, those drugs were based on the earliest genes we found back in the 80s and 90s that taught us about the early stages of the disease. So what we've been doing is trying to treat patients with early stage drugs targeted at early stages when they're already in the later stages of Alzheimer's disease. So there's been a disconnect, and this explains a lot of the failure.
But there's some good news yet again, right? Because in recent years, we've discovered something really amazing, which is that the changes in the brain that happen with Alzheimer's occur 10, 20, maybe 30 years or even more before the symptoms, the overt symptoms occur. So in recent years, there have been some certain techniques, brain imaging, brain scans, biomarkers, finding things that are in the brain that show up in the spinal fluid, or even genetic testing, the kind that Dr. Tanzi has helped to develop. So now we're able to perhaps identify people many, many years before the actual symptoms occur, people at increased risk. And maybe it's possible that some of these medicines that didn't work in people with severe disease, maybe they'll be more successful.
Yeah, I mean, the drugs we're working on right now still are targeting that first stage, but some of the ones, I have one company you had mentioned, I had begun to sell in Australia, is targeting both the amyloid and these tangles that form inside, and we'll have clinical trials read out sometime this year. We're very eager to see that. But in the meantime, we have to just hope that we got this right, that we're treating the right stage at the right time. And where we're really lacking is drugs that can hit that inflammation response, where the brain's immune cells are turning against it. We really have nothing that can help there. Ibuprofen and current anti-inflammatories won't do it.
Is there anything even in possible development at this point for that?
Right now, there's the information for the first time. We now know the genes just over the last year or so, the genes that control that response. And once you have that information, you can start thinking about drugs to target it. So that's going to be a big area going forward.
And this is going to get just worse and worse because about 95% of the people who have Alzheimer's are over the age of 65. So why is there such an explosion now? Well, we're getting a lot better at decreasing deaths from other things like heart attacks and strokes. So people are living longer. You live longer, you have a higher chance of getting Alzheimer's.
What, if anything, can you do to reduce the risk here then?
Well, there are a few things. I mean, nothing's going to guarantee that you prevent this disease. But what we know from epidemiology studies is exercise. What's good for the heart's good for the brain. So exercise actually helps get rid of that first material that accumulates, that initiates the disease, the amyloid. Exercise actually causes new nerve cells to grow in the brain in the area that's affected in Alzheimer's, the short-term memory part of the brain.
Interesting.
Diet, a Mediterranean diet, low fat's been helpful. Staying socially engaged, not sitting at home being lonely. Loneliness is a risk factor.
Really?
Watching this show right now, intellectual stimulation, making new synapses. The more synapses you have, it's like money in the bank that protects you. And most
sleep.
recently, yes, sleep. Sleep is really good for you. I should listen to my own advice because I probably don't get enough.
There's some housekeeping that goes on, and perhaps during sleep, your brain helps to remove the toxic metabolites.
Yes.
So social engagement, I love that. It's yet another reason to visit your loved ones and another reason to feel guilty for not doing that.
Take a brisk walk with them and talk about something interesting.
Well, given all your research, it really is a pleasure to speak with you, Dr. Rudolph Tanzi, and Dr. John Lapook. Always a pleasure.
Thank you both.